Hello, my name is Scott Cochran. I'm an MBA candidate at Western Governors University, and this is my oral capstone presentation. I am going to have to split my video in two separate sequences, so I'll have to keep an eye on the time here so I can keep it to under 10 minutes for the first part and under 10 minutes for the second part. My objective here is to convince you that I have obtained the knowledge and competencies and skills necessary to obtain the MBA designation. I'm going to do that by walking you through my personal history as it relates to my leadership abilities and skills. I'm going to talk to you a little bit about the MBA competencies that Western Governors would like me to hit on, and in the end I'll tie it all together and I think convince you that I should be able to get the MBA. My chosen career field is hospital administration. My past experience is a predictor of my future success, I believe. I have a long history of clinical leadership in interventional cardiology. Interventional cardiology is the treatment of cardiovascular disease percutaneously. I work in a cardiac catheterization laboratory. I began my career as a radiologic technologist. I cross-trained into cardiac invasive specialty. I am a registered radiologic technologist. I am a registered cardiac invasive specialist. I had a stint as an entrepreneur, and I co-founded a company called Invasive Coronary Professionals. We did temporary staffing in cardiac cath labs, and we did management and consulting. I've shown that I can get successful results in the business of healthcare. I do have a Bachelor's of Science in Healthcare Management, and I am currently the manager of cardiac and imaging services at Carson Tahoe Regional Healthcare. My leadership history is that when I was a teenager, I started out by being a coach, and I coached children that were younger than me. It was the first time that I learned about leading groups and teams. I had a successful experience with that, and as I went into radiologic technology, I tended to be someone who was very results oriented and wanted to grow always to the next level. I spent my first 8 or 9 years in a cardiovascular laboratory and was really on the ground floor of percutaneous coronary interventions. Again, that's the use of balloons and stents and wires to treat coronary artery disease. I learned from the early adapter physicians, and by the time the technology was ready to be more widely adapted, I had already a large amount of clinical experience. This allowed me to be a leader in the clinical setting, and my first leadership role came as the cath lab coordinator, clinical coordinator. I operated a cardiac cath lab and helped in the conversion from them performing just diagnostic studies to a full interventional coronary lab. During the time I was there, I assisted with staff development and training, and we were able to really build that program to be an effective treatment for coronary disease. I was then recruited by a hospital that was having difficulties with their clinical personnel. They weren't underperforming, they were losing volume. They recruited me to be a clinical specialist. I went into the program, I used my clinical leadership abilities, helped with staff development and training, and was able to revitalize the program and increase volume by 38% during a 5-year tenure there. During that time, about halfway through, I decided to try entrepreneurial adventures, and I was a co-founder of a company called Invasive Coronary Professionals. I performed the duties of COO. At the current time, I am a manager of cardiac and imaging services. I was recruited by Carson Tahoe Hospital to, again, convert a diagnostic-only cath lab to full interventional service. I was also recruited to help them move from a 50-year-old facility into a replacement hospital. I relocated up to Carson City about a year before the transition. I helped build the program and convert it to full interventional. I also led the conversion from one hospital to the other. Since I've been at Carson Tahoe, I've been sequentially promoted. When I first started there, I was only going to be the manager of cardiac and the cardiac cath lab, one cost center, and over the course of 5 years, I now have 15 cost centers and 2 service lines. So I'm over all of the radiology and cardiology services for Carson Tahoe. All of my reviews have rated me as an exceptional leader. When I moved up to Carson City, I felt like I needed to continue more formal education, which led me to pursue a bachelor's degree in healthcare management. I obtained that goal, and at the end I decided that I would continue my education with a master's in business with a healthcare concentration. I think I've proven a track record for being able to lead people in teams. My sources of power have always been my clinical expertise. It's the building block. So expert power has always been my style. By continuing the educational path and the experience that I've gotten in my management role, that's enabled me to extend my expert power to the business processes of healthcare. And then, of course, in my position, I have a formal authority. And I also like to think of myself as having a charismatic personal power. I am able to persuade people. Regarding developing sustainable solutions, I have a history of systematic and analytical approach to problem solving. I have the ability to anticipate outcomes and plan for contingencies. I have a proven track record of positive outcomes. Examples include a strategic reduction in force that I carried out and a successful restructuring of the cardiac service line. The reduction in force was a time when our hospital, as well as all hospitals, were looking at cost reduction strategies. I analyzed staffing patterns in the radiology department. I came up with some inconsistencies of the staffing versus the patient need. I restructured shifts and was able to reduce about 4 FTEs from the staffing. That has been sustained over a year. I was able to get the buy-in from the staff that a change like this was necessary. I felt like my leadership during that time of the people in the teams was effective, and the analytical approach that I took to restructuring the shifts had a positive impact on the ability to sustain that solution over 12 months. At this time, I am going to switch to go to the second file, and so I'll be right back.